Knock, knock. So, hello, my name is Brennan. I'm gonna be your nurse. Can I get your name and date of birth?
Austin Birchinger, 10-10-97.
And then, do you know where we are?
My house.
And do you know what day it is?
It is May 6th.
And then, do you know what we're about to do?
An at-home health assessment.
Yep. So, patient is awake, alert, and orientated ×4. I'll wash my hands. Okay, so, I'm gonna start by checking your eyes. What I'm gonna have you do is I'm gonna have you look at me and just kind of look like you're looking right through me. I'm just gonna shine this light in your eyes. Okay. Okay. Pupils appear to constrict. They're round and equal on both sides at about 5 millimeters. And I'm gonna check the accommodation. I'm gonna have you look at the tip of my light. Just follow it with your eyes. Okay. Okay. Eyes have a brisk movement and appear to converge on the light. Converge on the tip of the light when I bring it in close. Okay. No. Slur appears to be white, so no evidence of jaundice. And then I'm also going to check your mouth, so I have you open your mouth for me. And then, do you have any tonsils?
I do.
Okay. I have you go Okay, so 2+ on the tonsils. And then mouth looks pink, moist, and intact with no broken teeth or lesions or cuts of any kind. Lips are also pink and moist. No evidence of cyanosis at all. And I'm going to also, patient has a normal cephalic head with a midline trachea. And so now I'm gonna just check your lungs. I'm gonna lift your shirt up. Okay. Okay, so every time I move the stethoscope, I'll just have you breathe in and out. Okay. And then patient also appears to be in our erect position with no labored breathing that's noticeable. He was relaxed. And then now I'm gonna check your sides. check your back. Okay. So I'm gonna just put my hands on your back. I'll have you take a deep breath in and out. Okay. So patient's breathing appears to be equal. Thumbs moved apart the same distance on both sides and came back in at relatively the same time. Okay, so same thing as the front. I'll have you just take a deep breath in and out every time I move the stethoscope. Okay. All right, and then now I'll check your heart. So I'll just have you lift your shirt up again. Okay, and then just looking at the patient, he has a 2-to-1 configuration, or a 1-to-2 configuration with an oval shape. And the patient has not appeared to have any like marks or lesions, bruising, or any abnormalities of any kind on his skin, appearing to be intact and pink. Okay, I just gotta feel for your ribs here. Okay, so I'm checking the aortic valve, second intercostal space, right sternal border. Now I'm checking the pulmonary valve, second intercostal space, left sternal border. Now I'm checking the Erb's point, third intercostal space, left sternal border. Now I'm checking the tricuspid valve, fourth intercostal space, left sternal border. Okay. Now I'm checking the mitral valve, fifth intercostal space, mid-clavicular line. I'm going to check the applicable heart rate for about a minute. Okay, applicable heart rate is about 70 beats per minute. S1 and S2 were heard. Okay, and then now I'm just going to check your abdomen and lift your shirt up again. Okay, so just on a visual inspection, stomach is flat. I already said the configuration was 1-to-2 with an oval shape. And I don't see any abnormalities like striae, lesions, or abscesses. No bruising. Skin appears to be intact and pink. Okay, so now I'm just going to check your stomach in 2 spots in every quadrant. Starting with the right lower quadrant. Now I'm checking the right upper quadrant. Okay, now I'm checking the left upper quadrant. Okay, now I'm checking the left lower quadrant. Bowel sounds are active ×4, could be heard in every quadrant. Now I'm just going to do a palpation of your abdomen. Let me know if it hurts at all. I'm going to start with a light palpation. So I started in the right lower quadrant, now I'm in the right upper quadrant. I'm in the left upper quadrant. Now I'm in the left lower quadrant. Now I'm going to do a deep palpation, starting in the right lower quadrant. Now I'm in the right upper quadrant. Now I'm in the left upper quadrant. Now I'm in the left lower quadrant. No, everything appears to feel soft, and no hard like lumps or anything were felt. So nothing abnormal to report there. And then I'm just gonna ask some questions. So how often do you use the restroom, like having a bowel movement?
I'd say probably twice a day.
Okay, and what was the last time you had one?
Probably about 2 o'clock this afternoon.
Okay, and then when you do go out, do you have any issues, like having diarrhea, feeling nauseous?
Nope.
No? Okay. And then when you urinate, do you have any like burning sensations? It's painful?
Nope.
Oh, and then what color is the urine?
I'd say yellow.
Okay, and then how often do you urinate?
Probably like 3 times a day at least.
Okay, so straw colored urine, and doesn't appear to have any issues urinating or having bowel movements. Also, any history of heart disease in the family?
Yeah, heart attacks.
Okay, and do you know what kind?
I do not know.
Okay. And then, like, history of like cancer in the family?
My aunt and uncle do.
Okay, and you know what kinds?
Lung cancer.
Okay. And any history of any other kind of like respiratory issues?
I don't believe so.
No? Okay. And then what about neurodegenerative disorders like Parkinson's disease or anything like that?
I don't believe so.
Nothing like that in the family? Okay. Any history of like kidney disease?
Nothing.
No, nothing like that? Okay. Alright, so pretty healthy all around. Okay, and then next I'm going to check your arteries and then palpate your arms and legs. So we're gonna start with the carotid artery. carotids feel equal bilaterally at 2+. They're bounding. Skin appears to be intact, warm to the touch. And then now I'm just going to check your arms. Okay, patient is warm to the touch, doesn't appear to have signs of edema yet. I'm checking the brachial pulse. Appears to be 2+, bounding equal bilaterally on both sides. Okay, continuing to check the arms. Okay. Okay, so now I'm checking the radial arteries, the radial pulses, and they're both bounding at 2+. Equal bilaterally on both sides, no signs of edema on the arms, or skin appears intact, warm to the touch, and pink. Now I'm going to check the hands. I'm going to check your fingertips. Fingertips appear to be pink, and capillary refills are less than 2 seconds on each finger. Okay, next I'm going to check the femoral arteries. They'll be up in here. So they'd be 2+, equal bilaterally. And then now I'm going to check the legs. Continuing to check for edema. Appears to be warm to the touch. No edema appears to be present. Skin appears intact with no bruising or lesions or abscesses or anything. Have you take your socks off for me? Alright. So now I'm going to check the posterior tibial pulses. Appear to be equal bilaterally on both sides at 2+. Okay, and then I'm gonna keep checking the feet for edema. I'm checking the toes for capillary refills. Okay, less than 2 seconds on those. And then I'm gonna check the dorsalis pedis pulse. Appears to be 2+, equal bilaterally on both sides. No sign of edema on the feet. Everything appeared to be intact and pink and warm to the touch. Okay, and then now I'll have you pick your feet up off the floor and just try to like kind of move your feet up and down like against my hands. Yep. Now pull and push them down. Okay. Then I'll have you push me away. Pull me away, or pull me. So 5 out of 5 on strength for the legs and feet. I'll have you put your arms out in front of you like this. I'll have you pull me in. I'll have you push me away. Again, 5 out of 5 for strength. And then I think we're done.